Posterior compartment of the thigh include three muscles: bicep femoris muscle, semitendinous muscle, and semimembranous muscle. Now if I show you the cross section of the thigh, then you can appreciate the interior compartment, medial compartment, and the posterior compartment. And in the posterior compartment is present these three muscles. Knowing the cross-section view is important because CT scan or MRI will give us cross-section slices, and identifying these muscles over there is important. In the MRI, this is the interior compartment, medial compartment, and the posterior compartment. And these are the three muscles in the posterior compartment. First, we will discuss the bicep femoris muscle. It is also one of the hamstring muscle. Other being semitendinous muscle, semimembranous muscle, and the hamstring part of the adductor magnus muscle. It is lateral in position in the posterior compartment. As you can see, it is on the lateral side of the posterior compartment. Also, if I show you the cross-section view of the thigh, then you can appreciate the lateral position of bicep femoris muscle in the posterior compartment. This muscle has two heads. As the name suggests, bi, which mean two. First one is the long head and second one is the short head. First we will discuss the origin. The long head originate from the inferior medial part of the upper area of ischial tuberosity. This is isolated hip bone with the interior view. In the posterior view, this is the ischial tuberosity. This is the upper area of the ischial tuberosity, and below is the lower area. And from the inferior and medial part of the upper area arises the long head of bicep femoris muscle. From this same area also originate semitendinous muscle, but that we will discuss in the next video. Next is the short head of bicep femoris muscle. The short head originate from the lateral lip of the linea aspera on the shaft of the femur bone. This is isolated femur bone with the interior view. In the posterior view, this hole is the linea aspera. It has two lips, the medial lip and the lateral lip. And from the lateral lip of the linea aspera originate short head of the bicep femoris muscle. After origination, the muscle belly of the long head crosses the posterior thigh obliquely, that is from medial to lateral side, and it is joined by the short head distally. As you can see, distally the long head is joined by the short head. Together, fibers from the two heads form a tendon called bicep femoris tendon, which is palpable on the lateral side of the distal thigh. As you can appreciate in this image, here this is the tendon of bicep femoris muscle. Next is the insertion. It is inserted on the lateral surface of the head of fibula bone. This is isolated fibula bone with the interior view. This is the head of the fibula bone. The medial surface of the head is attached to the tibia bone, while on the lateral surface is attached the bicep femoris muscle. Next is the innervation. It is innervated by sciatic nerve. The long head is innervated by tibial division of the sciatic nerve, while the short head is innervated by common fibular division of the sciatic nerve. Next is the action. Bicep femoris muscle crosses two joints, the hip joint and the knee joint. At the hip joint, it extends the thigh, and it makes sense since this muscle is present posterior to the hip joint. So contraction of this muscle will pull the thigh in this direction. At the knee joint, it flexes the leg. And since this muscle passes posterior to the knee joint, so contraction of this muscle will pull the leg in this direction. It also laterally rotates the leg. Since it is inserted on the lateral surface of the proximal fibula, so its contraction will rotate the leg in this direction. Next, I will discuss semitendinous muscle. Thank you.